It can be a little scary to notice spotting after sex. You might find yourself feeling anxious or worried about what it could mean. It's completely natural to have these concerns, especially if it's something you've never experienced before. Spotting can be alarming, but it's important to stay calm and gather information. You might worry about what's going on. Is it a sign of something serious? Could it be an indication of an underlying health issue? These thoughts can race through your mind, making it hard to focus on anything else. But remember, you're not alone in this. Many women experience spotting at some point in their lives. Spotting is any light bleeding from your vagina. It can occur for a variety of reasons, and understanding these reasons can help ease your mind. For instance, it might happen due to hormonal changes, stress, or even as a side effect of certain medications. It is different from your period. While your period is a regular, heavier flow of blood, spotting is usually much lighter and can occur at any time during your menstrual cycle. Keeping track of your cycle can help you identify patterns and understand what's normal for you. It's important to remember that spotting can happen for different reasons. Don't panic. Sometimes it can be as simple as a minor irritation or a result of physical activity. Other times it might be related to ovulation or implantation if you're trying to conceive. Most of the time it's nothing serious. However, if you notice that the spotting is accompanied by other symptoms like pain, discomfort, or unusual discharge, it's a good idea to seek medical advice. Your doctor can help determine the cause and provide reassurance. Remember, every girl's body is different. What might be a normal occurrence for one person could be unusual for another. This diversity is what makes each of us unique, and it's important to understand and respect our own bodies. This means what's normal for one girl might not be normal for another. Sharing experiences and talking openly with friends or family can provide comfort and help you realize that you're not alone in this. If you're ever worried, it's always best to talk to a trusted adult or see your doctor. They can offer guidance, support, and the information you need to feel more at ease. Taking care of your health is important, and seeking help when you need it is a sign of strength. Sometimes, spotting can be an early sign of pregnancy. This is called implantation bleeding. It happens when a fertilized egg attaches to the lining of your uterus. This usually happens about 6 to 12 days after ovulation. However, not all spotting in early pregnancy is implantation bleeding. Sometimes there can be other reasons for spotting even if you're pregnant. It's best to pay attention to your body and any other symptoms you might have. There are many other reasons why you might experience spotting after sex. While pregnancy is often the first thought that comes to mind, it's important to consider other potential causes. Spotting can be a sign of various underlying conditions or changes in your body that may need attention. One common cause is cervical irritation. This irritation can occur due to several factors, including vigorous sexual activity or insufficient lubrication. The cervix is a sensitive area, and any form of friction or pressure can lead to minor bleeding or spotting. This can happen during sex, especially if there was a lot of friction. It's not uncommon for couples to experience this, and it doesn't necessarily indicate a serious problem. However, if the spotting persists, it might be worth discussing with a healthcare provider to rule out any complications. Infections, like sexually transmitted infections, can also cause spotting. These infections can inflame the cervix and other reproductive organs, leading to bleeding. It's crucial to get tested regularly and seek treatment if you suspect an infection, as untreated STIs can lead to more severe health issues. Sometimes hormonal changes, like those that happen during your menstrual cycle or if you're on birth control, can also lead to spotting. Hormonal fluctuations can affect the lining of the uterus, making it more prone to shedding small amounts of blood outside of your regular period. Polyps or fibroids, which are small growths in the cervix or uterus, are other possible causes. These growths are usually benign but can cause irregular bleeding or spotting. Regular checkups and ultrasounds can help detect these growths early, allowing for appropriate management and treatment. Section 4. When to take a pregnancy test. If you think you might be pregnant, the best time to take a pregnancy test is about 1 to 2 weeks after you had unprotected sex. This is because it takes some time for your body to produce enough of the pregnancy hormone, HCG, for the test to detect. Home pregnancy tests are very accurate when used correctly. Be sure to follow the instructions on the test package carefully. Section 5. Seeking medical advice. Better safe than sorry. While occasional spotting after sex is usually harmless, it can still be a cause for concern for many. It's important to understand that our bodies can react in various ways, and sometimes what seems minor can be a sign of something more significant. There are times when it's crucial to see a doctor. Ignoring symptoms or delaying a visit can sometimes lead to complications that could have been easily managed if caught early. If you experience heavy bleeding, severe pain, foul-smelling discharge, or any other unusual symptoms, it's essential to take them seriously. Fever along with spotting can be a sign of an infection or other medical conditions that require prompt attention. Seek medical attention right away if you notice any of these symptoms. Early intervention can make a significant difference in outcomes. You should also see your doctor if you have spotting after menopause. Postmenopausal bleeding can sometimes be a sign of more serious conditions, and it's always better to get it checked out. If the spotting continues for more than a few days, it's another indicator that a medical consultation is necessary. Keeping track of your symptoms and their duration can provide valuable information to your healthcare provider. Remember, it's always better to err on the side of caution when it comes to your health. Regular checkups and being attentive to your body's signals can help you maintain your well-being and catch potential issues early. Don't hesitate to reach out to a healthcare professional if you have any concerns. Section 6. Remember, you're not alone. Spotting after sex is a common experience for many girls and women. It doesn't always mean something is wrong. However, it's important to be aware of the potential causes and know when to seek medical advice. By understanding your body and staying informed, you can approach this issue with confidence and ensure your reproductive health.